Welcome to Learn Medics. Today we are going to deal with inflammation. In this module, we are going to deal with inflammation, mechanism of inflammation, and in the whole series of inflammation, we are going to deal with systemic inflammation, acute and chronic inflammation, which I have a separate video on that both. So, inflammation. Inflammation is a process of eliminating pathogens and damaged tissues during healing from the body. Inflammation is commonly seen in various conditions like infections, trauma, or after surgery during healing. So the inflammation is characterized as two, that is acute inflammation and chronic inflammation. Acute inflammation means it is a rapid onset when an infection or trauma occurs, like it is from minute to hours, and a quick resolution also happens within days. There is a resolution for the inflammation. And for example of acute inflammation is the sore throat. While in the case of chronic inflammation, it is prolonged and may last weeks, months, or years. Like in case of cancer, the inflammation is last for years. So, the elimination of pathogens and damaged tissues from the body may cause damage to the host too. That is, excessive inflammation. In the case of excessive inflammation leads to sepsis. In the case of a severe injury or prolonged inflammation leads to chronic inflammation, and the infection or inflammation fails to resolve. And there is an inappropriate inflammation occurs during the immune diseases. That is all about the basic concepts of inflammation. The five cardinal signs of inflammation, they are the rubor, which is called redness, the color, which is called warmth or temperature, tumor, which is caused due to swelling, toler means pain, and loss of function or loss of function, which is caused by all these cardinal signs. Though the rubor and color, that is redness and temperature, is caused due to the vasodilation and increased blood flow to the area of inflammation, and swelling happens due to the increased vascular permeability that brings proteins and various components to the site of inflammation, and dolor, it is caused by the bradykinin. And loss of function, as I mentioned, it is caused due to all these cardinal signs leads to loss of function of a cell. That is the five cardinal signs of inflammation. So we are going to deal with the mechanism of inflammation. The main mechanism include the vasodilation mechanism, the vascular permeability that happens to the tissue undergoing inflammation, and pain which we feeling during inflammation. So the vasodilation, as mentioned before, it is due to the vasodilation we have the rubor and color, means redness and temperature happens to a inflammatory cell. It is due to the arterial vasodilation caused by several triggering substances released from the inflammatory cells that leads to the vasodilation. The triggering substances that leads to the vasodilation are the histamine, prostaglandins, and bradykinin, which we are going to discuss in detail in this module. And the second mechanism of inflammation is the vascular permeability. Due to the vascular permeability, we have tumor or swelling happening into the inflammatory cell. It may cause by direct injury to blood vessels, leads to leakage of plasma, and there are many triggers like leukotrienes, histamines, and bradykinin are also responsible for the vascular permeability. Next one is pain. Pain is due to the prostaglandins E2 or PG2, which is secreted during the inflammation, and which is increases the sensitivity to pain and causes the fever. So we are going to detailing of mechanism of inflammation. That is first one is the vasodilation. There are three triggers that are responsible for the vasodilating effect happening to an inflammatory cell. That is histamine, prostaglandins, and bradykinin. So we are going to deal with that all triggers. First one is the histamine. Histamine is stored in mast cells, basophils, platelets, and released quickly when an inflammation is setting. So we know that there is an influx in histamine during an inflammation occur. So we are using some antihistamines drug to treat the overactivity of histamine. Second one is the prostaglandins, which is released also. It is also released from the mast cell, which is synthesized via the arachidonic acid. It is the main pathway of synthesizing of prostaglandins. During the arachidonic synthesis, we get so many substances called eicosanoids, are the signaling molecule derived from the arachidonic acid. The prostaglandins is also a type of eicosanoids. The examples of eicosanoids are prostaglandins, leukotrienes, and thrombohexines. In which prostaglandins, the main example for prostaglandins is PGE2, responsible for vasodilation. Here we can see a chart, a representation for releasing of prostaglandins. First of all, lipids. From the lipids, with the help of phospholipase A2, the arachidonic acid is formed. From the arachidonic acid, three eicosanoids are formed. With the help of lipoxygenase enzymes, leukotrienes are formed. With the help of cyclooxygenase, prostaglandins and thrombohexines are formed. From the prostaglandins, vasodilation is occurred. Thus, the histamine and prostaglandins help for the increasing of vasodilation during an inflammation is setting. So, the next one is the bradykinin. It is a third component of the triggering substances for the vasodilation, which is linked to clotting cascade. Inflammation leads to activation of clotting factors, including factor 13 called Hegman factor, which I will deal in detail in my hematology videos, and produces bradykinin via the kinin system with the help of factor 13. So we will discuss the kinin system and everything in hematology video. I will mention everything there. Bradykinin is an highly vasodilator, which increases the vascular permeability and pain, which is degraded by angiotensin converting enzyme, ACE enzymes, and C1 inhibitor of complement system. So, AC inhibitor causes increase in bradykinin, which leads to angioedema. This is the main side effect of the AC inhibitor drug. It is a pharmacological link. And C1 inhibitor deficiency means it has a increased bradykinin, which occurs in patients with hereditary angioedema. Second mechanism of inflammation is the vascular permeability, which is due to the direct injury to vessels, which I have mentioned earlier. Mediators causes increased vascular permeability are leukotrienes, histamine, and bradykinin, which creates a contraction on endothelial cells, leads to the formation of gaps between the cells, especially in postcapillary venules. Here we have the postcapillary venules. The leukotrienes, histamine, and bradykinin. During inflammation, these substances creates a contraction on endothelial cells, leads to the formation of gaps between the cells, especially in postcapillary venules. The vascular permeability increases due to the oncotic pressures that driven by protein, especially the albumin, which leads to the tissue edema. Tissue edema is also in two forms, exudate form and transudate form. This is the basic concepts of how the vascular permeability is increased in an inflammation, which is due to the contraction of endothelial cells that leads to the gaps between the endothelial cells, which is stimulated by the leukotrienes and histamine and bradykinin. I am going to conclude my video with discussing this last topic, the tissue edema. Tissue edema is the main side effect due to the vascular permeability. So the vascular permeability increases, blood can reach out of the in extracellular space and causes the edema. Tissue edema is of two type, exudate and transudate. Exudate is the fluid leak in a tissue that form inflammatory edema. Exudate is formed due to an inflammation occur. Fluid leak into the tissue from the blood vessels during inflammatory process, which from the high vascular permeability, which commonly seen in infections and malignancy, driven by oncotic pressure, that is pi, which is oncotic pressure. And this exudate, if we test in lab, we get a high protein content, that is albumin presence, because pi, the oncotic pressure is depend on the albumin presence in the blood vessel, and which is also high specific gravity because it is concentrated, and which is seen in infection and malignancy. But it is contrast to transudate. Transudate is also a fluid-like substance which is due to increased hydrostatic pressure, not oncotic pressure. Exudate is oncotic pressure, which is driven by protein, but transudate formed due to hydrostatic pressure, which is based on the normal blood pressure, which is not driven by protein. So fluid leaks, but not due to the inflammation. Exudate is formed during the inflammatory process, but here transudate is not due to the inflammation, and which have low protein content, low specific gravity, and which is usually seen in heart failure and low albumin levels. But in the case of exudate, which is high protein content due to albumin presence and high specific gravity, which is concentrated and seen in infection and malignancy. So that's all about the basic concepts of inflammation. In next two videos, we will discuss the core areas of how the systemic inflammation is happening. In this lecture, I have mentioned the basic concepts happening in the tissue level, where the inflammation occurs, what happens to the area of that tissue level. In next two videos, we are going to deal with the systemic inflammation happens to the whole of body and the chronic and acute inflammation. Thank you guys. Thank you for listening me. Have a great day.